This one. Ready? Okay. Hi. Good morning. It's Dr. Makarov here. I'm going to remove my mask now so I can talk to you more freely. And I hope everyone is healthy as well. And today I thought we'd talk about social distancing and also some at-home IVF options. So right now we're in New York City and definitely feeling the effects of COVID-19 and doing our following the social distancing recommendations, and I'm very aware of how that impacts fertility and fertility treatment. What we're doing here at the clinic is we really are, when people are coming in for monitoring, we're making sure they stay 6 feet apart and trying to minimize monitoring as well. So as far as the virus, have been some viruses in the past that have affected fertility. Zika is a well-known one, and that one actually could live in sperm for up to 6 months and be transmitted to pregnant women and have very bad effects for the pregnancy. So with the COVID-19, we don't see an impact like that on fertility as far as we know. Of course, we're always learning all the time about this virus, but as far as we know, it does not have some sort of impact like that, which was very dramatic for fertility with Zika, but not with COVID-19. So there's that. And then in terms of pregnancy, again, also like Zika had a big impact on pregnancy, caused malformations and huge problems. But with the COVID-19, we haven't seen so far problems in terms of like pregnant women are not more susceptible to getting the virus, or also pregnant women are not more susceptible to getting worse effects of the virus, which can actually happen with the flu. One reason we recommend that all pregnant women get a flu vaccine is that, especially for some strains of the flu, pregnant women can get more sick basically when they get the flu. So, so far, we haven't seen that with COVID-19. And again, we're still learning all the time. But right now, that's what we know. And so we also don't know how long this will all last. And so the issue with this time and fertility is that fertility is really, really tied to age. And time is a huge factor with fertility, especially for women over age 35, becomes more dramatic after age 37. And we actually call it a fertility emergency after age 40. Because some women begin to lose their fertility or their chance to have a pregnancy and their fertility after age 40 very dramatically. So for some women, it's hard to push this off, especially with an unknown time point with the virus currently going on. So with keeping that in mind, and also keeping in mind what we all need to do, which is social distancing to prevent the spread of COVID-19. We have come up with some ways which we've come up with ourselves here, which aren't being done widely, and also some things that are more commonly done. So in terms of fertility, it's really important to keep in mind your age and how long you can wait, or for some women it's like the choice, are you going to give up the chance to have your own baby during this time? It's a tough choice. We don't know how long this will last. So what can we do about it? So for younger couples, of course, you can have intercourse at home. Some people think there's going to be a whole 9 months from now, labor and delivery wards will be very busy because there'll be everyone stuck at home together, and there'll be a lot of COVID-19 babies But even when you're under age 35, if you've been trying for a year or you have really painful periods or irregular periods, then you're going to need some fertility help. And how can we do this in a way that takes into account social distancing? So what we first recommend is that you schedule a phone or a video consultation, okay? And so we can review your history and see what works best. The video consultations are working really well, and you can really get a personalized treatment plan after we review and detail your history. We like to know a lot about your menstrual cycle. How long is it? How is your bleeding? Is it painful? And we look at all that, and then we can come up with a treatment plan, which may be for some couples you may be prescribed a fertility medication that you can take at home. And then you can use at-home ovulation predictor kits. These can be ordered online or picked up in a pharmacy, where you can test your ovulation to make sure the treatment is working, to make sure you're ovulating. And it also helps you pinpoint when to have intercourse. And that's important because the egg can only be fertilized for a short time every month. So that would be a simple way to start, and that may be particularly useful for couples, especially when the woman is age 35 or younger. Another option that we have, which at home, again, trying to stay home as much as possible. So this would be something called medicated insemination cycle, or IUI cycle. So how this works is you would take a fertility medication, which is a pill that you take for 5 days, and you can take it at home. And then also to minimize coming into the office, you can use these ovulation predictor kits. What these ovulation predictor kits do is they measure a hormone called LH. LH causes the surge, is the hormone that surges and causes you to ovulate. And these kits can measure it in your urine. So you're checking your urine all along when you may be ovulating. Once you get a surge, a positive surge, if you say a good time to test is in the morning when you first get up, you can check your urine, and then you can call us and let us know, okay, today my kit's positive, which means your egg is going to ovulate. So you can come in same day appointments for an insemination, where we can put the sperm, wash the sperm, and put it into your uterus, and that will really give you a fertility boost. This could be for women who are over age 35, or say if younger women, say you've been trying what we call timed intercourse, which is you've been taking a fertility medication, a pill like Clomid or Letrozole, you've been taking that and have intercourse for a few months and you're still not getting pregnant. So this can be a next step, while also doing as much social distancing as we can and minimizing office visits, but also, again, allowing you to continue pursuing fertility and pregnancy during this time. So that's a way to do sort of like at-home IUI or social distancing IUI cycles. Okay, so usually for an IUI to work, we give that. This is for couples who really have been having trouble getting pregnant, and that is for trying to get pregnant or having unprotected intercourse for over a year under age 35, or over age 35, we shorten that interval because of that dramatic drop in fertility we see with age. So over age 35, 6 months. And again, you can forget all of this if you have like cycles that aren't regular or 28 or 30 days. If they're really irregular or very painful or heavy bleeding, then just schedule a time to review your history right away, because those could be signs of diseases that are decreasing your fertility, and you wouldn't want to just wait. But if you have regular cycles, and then say you haven't gotten pregnant after 6 months of trying after age 35, or age 40, which is when we see that dramatic drop in fertility. It's like what we call the fertility emergency. So if you're age 40 and wanting to get pregnant, just call and schedule a video consultation right away. But IUI will work well in the age group of age, say, 35 to 40, and also younger age groups who haven't been able to get pregnant other ways. Okay, but so with IUI, each cycle, the chance of pregnancy is maybe you could say 15% chance of pregnancy for each menstrual cycle, each month. Basically, you give IUI, the IUI treatment is one time a month you could do an IUI treatment. So you would try that for 3 months and see if you're pregnant, and that's giving it a good chance to work. Because it doesn't, even though we're optimizing everything, it doesn't work 100% the first time. You have to give it three to four tries, let's say, to give it a fair chance to work. So you could do that with basically coming into the office one time a month. So that would really minimize, still being able to maintain the social distancing. Okay. And then say you've given it, for example, 3 to 4 tries with the IUI and you're not pregnant, then we start thinking about IVF. And that was more of a challenge, honestly, to develop with a way we could do it with social distancing. But it was really a priority for us. We have a few priorities is to try to do IVF more naturally, to use your natural hormones, and also do it in a way that you don't have to come in so much to stay safe. So traditional IVF is really scary for a lot of people because it's a lot of injections, and you have to give injections in your abdomen. But these injections are actually hormones that your body makes naturally and gives you for free and natural, and they're made by your brain. So you can give pills that boost these natural hormones from your brain, and you sort of revs up the production of these natural hormones. So that's one of the theories behind this at-home, what we call at-home IVF, or you could call it social distancing IVF, where you don't have to come in so much to get checked, because we're using a lot more of your natural hormones, which are safer and less expensive and fewer injections. Okay, so because it's safer and more natural, you don't have to come in so much for blood draw and ultrasound. We can really minimize that a lot because you're boosting more your natural hormones, which is a safer way to do IVF. So how we do it, usually you're taking 2 different kinds of pills to boost your natural hormones at the same time. And you take those hormones a set number of days. You also add in a little bit of a third pill to prevent ovulation. You don't want the eggs to release before we can collect them. And then again, we also make use of those at-home ovulation monitoring that you can do at home. So when your body is starting to want to ovulate, you would, if that were to happen, you would call us right away. So we know your body's ready to ovulate the eggs that you made, and we could collect those eggs. So, and then at the end, after you've taken this, so the eggs usually grow for the first 2 weeks of your cycle. So that's during the time that you would take these pills at home to boost your natural hormones. And this can get more than 1 egg to grow, which we can then collect. And so you're taking these medications, usually it ends up being maybe for a week and a half. And then you take a last medication, which can be given either as a nasal spray, or sometimes that is a 1 injection that you would take, and that will trigger the release of the eggs. And then we can go ahead and collect those eggs and fertilize them. And we collect them, it's a vaginal ultrasound, and suction goes into the ovary, gently suctions out the eggs. So that's when you would come in. So again, because this is using more of your natural hormones and not so many high dose synthetic hormones or injections, we're able to either eliminate the monitoring altogether, where you don't need to come in for ultrasound, so you can maintain your stay-at-home social distancing while still not giving up on your fertility. And so either no monitoring, you come in just for the egg retrieval. Some people choose to come in for a one-time monitoring. Compare this to a conventional IVF cycle, where you may come in 8 times for monitoring. So it's a way to allow yourself still to have some treatment as we're in this time of social distancing, while also maintaining your safety and others' safety as well. And we're happy to offer that for you, because this is all important to us, couples and women's fertility, and also being safe and maintaining social distancing for everybody. you. Does anyone have any questions? See a few people have logged on here. Let me know. And I'll give you a little bit of history of our more natural and less invasive ways. So that's it is quite different than what other fertility centers do, which is how we're able to safely offer this type of treatment while also maintaining the social distancing, which is so important right now. But this isn't something that was even just created during this time. It's actually something we've been working on for a long time, and ever since our clinic started here in 2004, we've always wanted to minimize the number of synthetic hormones you need to inject and maximize your own natural hormones, which is a much safer way to do IVF. And so we've been doing this for over a decade. So we have a lot of experience of how to do this and how to do this safely. And it's great. It's great for right now when you don't need to be coming in and traveling, really, not the time to do that. So it's a really great way to be able to still, again, not give up your hopes and dreams of a family during this time, which for some women over 40, if they have to delay their fertility treatment too long, that may happen. So it's a way to keep both priorities safely. Why does the IUI success rate go up with each IUI? I had a question, why does the IUI success rate go up with each IUI in 3 to 4? It doesn't, it's cumulative. So, if you're at 1585, it starts to level off after IUI treatment. It's cumulative up to 3 or 4 cycles, and then it levels off a little bit, sometimes a little bit up until, say, 6 cycles of IUI. So I have had some patients do up to 6 cycles of IUI, but it starts to level off the cumulative rate of pregnancy after 3 to 4 cycles. So that's why we recommend 3 to 4 cycles. IUI. All right, any other questions that anyone has? Again, we're talking about today social distancing, fertility, and at-home fertility treatments, including at-home IVF. It's our priority as fertility and social distancing combined, and how can we do that safely, and how can we be innovative in our approach to allow women to maintain their fertility during this really difficult time. Sorry. Okay, well, thank you all so much. I'm going to sign off now. If there aren't any other questions, I'll give it, but we are offering now until mid-April free video consultations. Also, it's our priority, again, to counsel and make individualized treatment plans using women and couples' natural fertility during this time, and to make that accessible to women and couples, not just in our local area, but across the nation and internationally. We are offering free video consultations with me and with all our doctors here. So let us know if you'd want to talk further about your fertility, your case, and how to make a plan that's safe during this time when none of us want to be out of the house much. Okay, thank you. Bye.